Hello, my name is Karan. So today we are going to be focusing on a couple of pretty common vision therapy exercises that can help us to train somebody's both the accommodation and the convergence. So basically, we'll be talking about three activities. The first one, which is my favorite, we have a near far heart chart. Basically, during this activity, we have somebody like our patient hold the near chart. I'm just going to quickly show it to you here. It has a series of letters. We want the patient to hold the chart as close to their eyes as possible so that they are still able to see the chart clearly. And we will have the patient read the first line on the near chart, and then we have another chart which is further out, and we have the patient stand all the way far in the back of the room so that they can still see the far chart clearly, and we'll have them switch one line from near chart to one line on the far chart. During this activity, if we are using both the eyes, as in when we are doing it binocularly, we are working on both their convergence, divergence, as well as their accommodative skills. And if you are doing it monocularly, as in if you are closing patient's one eye and just working on one eye at a time, you are exclusively working on somebody's accommodation as to how they are able to hold their accommodation for up close and how well they're able to relax their accommodation when they're looking at the further chart. So, like I said, you can do both monocularly and binocularly. The second activity which we can do is we can incorporate similar fun things, especially when you are dealing with little ones in your clinic. To help engage the kids, we can incorporate some of the board games, which can be a lot more fun with the kids. So, the one that I like doing is the battleship game. So, here we have instruction on the whiteboard, which is the number two here, and the child will be sitting with the board game pretty close to their eyes. And again, we are working on the convergence, divergence when they are doing it binocularly, as well as the accommodation. And if you're doing it just with one eye, you're just working on accommodative skills. So again, patient is trying to incorporate the instructions from the board and trying to work their way onto the board games. The third thing that we can do is we can incorporate a small puzzle. We have a qubits instruction card which tells them how they are going to lay out the puzzle, which would be up close here, and the kid would again switch back and forth from distance and near. Again, the same idea, just different ways of doing things and different ways how we can keep our patients engaged and still be able to work on their accommodation and convergence. And the last thing that I would like to wrap it up with, we can also have this alphabets with the strings. We can use this similar chart that we used for the near for heart activity, the first one on the board, and we can pick out just one random line to start with. We can start with the first line on the chart, and patient would basically pick out the same alphabet from the far chart, and they would just put them into the string and go all the way from first alphabet to the last one. So these are some of the ways where we can work on improving somebody's accommodation and convergence skills. Thank you.